All right. Well, why don't we go ahead and get started? Don't want to waste any more of your time here. Just a heads up that this training has only been lasting about 20 to 30 minutes, so we should wrap up and also have plenty of time for questions. Hello, my name is McKenna Dahlquist. I'm a project manager here at Comagine Health. We have a couple other people from the project team at Comagine Health on the line, and then we also have Brian Cagle, who's the project manager at Nevada DHCFP. He's on the line if any questions come up for him. So again, welcome to the NHQR portal training. We had some webinars earlier this month or last month, and there is some repeat information, but we're going to go a little bit more into depth here. So just a quick agenda to get us started. So first, we're going to talk about similarities and differences to the old portal, kind of getting us started with that intro there. Then we're going to dive into registration, activation, and logging in, followed by your dashboard and its functionality. And then we'll dive into the reports that you'll actually be filling out, and then we'll go through next steps. Please feel free to enter any questions in the chat at any time. There will be time for those, and I'll pause as those come in. And then there'll be time at the end as well if you want to come off mute to ask any questions. This training is being recorded, and we are sending out the recording link and the slides once we have complete. Okay. Done with the setup here. So I'm just going to call out a few similarities to the old portal. And then just a heads up that we designed this portal to be very similar to the old portal. The data that you enter is the same data. It's in the same order and everything like that. We didn't want to do any redesign of that to confuse you all or cause you any extra stress here. So just a heads up, it's very similar to the old portal. So first being the activation of your account is similar in that after you register online, you will have to take an extra step of activating your account. And we'll go through what those details are later on. Your dashboard is going to look very similar to your dashboard in the old portal, where you have the report that you're working on, and then you can like edit it, review it, sign it. We'll look into that as well. This new portal still has the editor and signer roles, just like the old one. And skipping down to the last bullet here, there can be 2 users assigned per each facility, and each of those users can be both an editor and a signer for your facility. As I mentioned, it's the same data as the old portal. It's the same order and flow. It's the same field definitions for each of the fields that you're filling out. And then finally, it's the same deadlines for you all. So quarterly reports are due at the end of, or 30 days after the end of the quarter, and monthly reports are due 5 days after the end of a month. So key differences to the old portal. The new one has an autosave feature. So as you're filling in your numbers, it's auto-saving. If you exit and come back, your numbers should be there. I know with the old one, you had to, hit save as you're going through just to make sure it saved your numbers, but this will be auto-saved. No need to hit save as you're filling out. Another difference for the new one is that it's a little bit more seamless. If you're both an editor and a signer, your workflow is a little bit more seamless, so you don't have to go back to your dashboard and toggle in between your 2 roles. If you're both an editor and a signer, you can just like start your report, fill it out, send it to yourself, review it, and sign it. And we'll go through that workflow here in a little bit. And then another key difference is the way that you view your validations. It's a little bit different. I think on the old portal, there was a checkbox that you hit and all your validations would come up, validation errors. And with this one, you can hit enter on your keyboard to see those validations, or you can scroll to the bottom of your report and hit continue, and those will pop up. So again, we'll dive more into that. So just some key differences and similarities. Okay, so starting from the beginning, which is registration. So everyone will need to register for this new portal. If you haven't done so, please do so. So what you're going to do is you're going to go to nevadacomparecare.net, and in the data submission section of the website is where you're going to register. There's a register button there. Registration is going to ask for your first name, last name, email, a password, organization, job title, phone number, and type of data. One note on the phone number, it is going to be used for two-factor authentication. You'll be texted a code that you'll have to put in. So please use a cell phone number. We did that type of two-factor authentication because it is the most secure. And we definitely want to keep your data as secure as we can be. So please enter a cell phone number there. And then in the type of data box, there's a drop down and you're going to select NHQR. That is the type of data we're talking about right now. This portal is used for UBO4 data as well. So just a heads up, select NHQR for this financial and utilization data. As mentioned, there is two-factor authentication via text message. So after you register, you'll get a text and you'll have to enter your code into the browser. And then just a heads up that you'll only need to re-authenticate via this two-factor authentication every 90 days. So not every time you sign in, just every 90 days. Okay, so as I mentioned at the top, account activation is required after you register. So once you register, you're going to receive a confirmation email. In that email, it'll have instructions on how to activate your account. The instructions are to email nhdr@comagine.org with your name, your facility name, and your role assignment, whether you want to be the editor, signer, or both. If you have multiple facilities, please include those in your email as well. So once you email us with that information to nhdr@comagine.org, then we can activate your account on the back end. You'll receive a notification and you'll be ready to fill in your reports. Just a note here, I'm not sure if anybody on the call submits UBO4 billing data as well. If you happen to, and you already have an account on our portal for submitting UBO4 data, just email us with this information here and we'll get you set up on the back end. There's no need to register a second time if you already have an account for that. All right, so once you're all registered, you can then log in to submit your reports. Your username is your email address. And then just a heads up that there is the functionality within the portal to change your password at any time. And then once again, you do need to activate your account before you can fill out reports. So after you register, please email us. If you have not activated your account, when you log in, you're going to hit this welcome page here that doesn't allow you to go any further and fill out your reports. It'll let you know you're registered but not activated. This is what you need to do. So once you have been activated, you've emailed us, we've got you set up on the back end. Your welcome page is going to look like this, where there is a Nevada Healthcare Quarterly Report hyperlink that you can click on to then start filling out your reports. So you log in, here's your welcome page. You're going to click this hyperlink here, Nevada Healthcare Quarterly Report data. And then from there, it'll populate your dashboard. I'm going to take a pause here to see if anybody has any questions about the similarities or differences to the old portal or registration or logging in. Feel free to put them in the chat or come off mute. Okay, no questions is also good too. So we'll keep going. I'll pause again here in a little bit. So after you log in, you can access your dashboard. And on your dashboard, there's going to be two drop downs, one for your facility. And then just a note, if you submit for multiple facilities, this will be a drop down and you'll have to select your facility. But if you submit for only one facility, then it'll just auto populate. There's nothing you have to do to select your facility. It should just be there. And then the second drop down is your report type. Now, if you are a hospice, an intermediate care facility, or a skilled nursing facility, your report type will automatically be populated in this box. So if you're a hospital, though, you will have to select whether you want to look at your financial report dashboard or your utilization report dashboard, because hospitals have the two types of reports that they're filling out. So once you select your facility, if it's not already populated, and you select your report, if it's not already populated, then you will see your dashboard. Like I said, it's similar looking to the old portal. This example right here is a dashboard of someone who is both an editor and the signer. They have both roles. So they have basically all the functionality, all the statuses and all the actions here. So if you're just an editor and you don't have signing capabilities, you may not have all of these statuses and actions. And same if you're a signer, you're going to have just specific ones to your role. So this is an example of a dashboard. I'm thinking that most of y'all won't have all of these statuses and actions showing at the same time. Hopefully it's a bunch of completed reports and then one open that you need to fill out. So there's your dashboard. So once you hit create or edit, or whatever you need to do to enter the report, any of these actions, it'll bring you to the actual report that you fill out, which looks like this here on the right side of the screen. So you're going to be inputting your facility numerical data in this middle column here, where it will show you what quarter or month that you're filling out the report for. So you can fill in your numbers, you can tab through as you're filling out your information. And as I mentioned, it'll auto save as you're filling it out. One a little bit different functionality from the other portal is the way that you view these field definitions. If you click on any of these fields, you'll see this pop up here that has your definition for you. And it has the field ID, which is the same field ID from the previous portal. That's one functionality. And then the other, as I mentioned, is the validations. So as you're filling out your report, you can hit enter to view your validations, or you can scroll to the bottom and hit continue and view them. But whichever way you view them, you'll see a message at the top of your report that shows how many total validation errors you have. And then you'll see the specific ones here in this third column. So to view the validation error description, you're just going to click on this pink box, the validation error, and then this will show up saying likely that your totals aren't adding up. The sum of all of these columns need to equal this column. That's the typical validation error. So you click on that to see your validation error. So once you have you got your validations and you've gone in and you've made your corrections and you're like, okay, everything adds up now. What you can do is you can refresh your page and that will see if your validation's clear. Or you can hit enter on your keyboard or the continue button at the bottom of your report. And then if everything's correct, those validations should clear. All right, so once your validation errors have all been corrected, all your totals add up, you don't see any pink boxes, there's nothing at the top. This button at the bottom of your report that said continue will now say send. It automatically knows, hey, there's no more validations, you're good to send it. So you hit send. And if you are oops, let me go back a little bit. If you're an editor and you hit send, that's when it'll send it to your signer and they'll get a notification saying that it's ready for their review and to sign. If you're in both an editor and a signer, you're going to hit send. It's going to basically send to yourself and you're going to see this success page saying it was sent successfully. And then there's one more step for you to do as the signer role. You're going to click this sign hyperlink to then go back into your report, review it as the signer, and then that's where you're going to click the checkbox next to your name that it's just saying that this is you and you have the credentials to sign this report, and then you're going to hit sign. And that is when the report will be sent to the state. From this signer perspective, if you don't have that functionality, you'll get a success page that says the report was sent successfully. This, box won't be here, and then the signer will then be able to go in from their dashboard and they'll see these functionalities down at the bottom of their report to validate and sign the report. Okay, that was a quick overview. Let's stop for any questions. Looks like we have one. Can a creator can also edit after submitting? Means you can go back into the report again. For the editor to make any edits, it needs to be sent back. Oh, so sorry. I didn't realize this was a direct message to me, so people couldn't see this question. Let me read it so everyone can hear. Can a creator also edit after submitting? Meaning you can go back into the report again. You can, it has to be sent back from the signer for you to edit again. After you send your report to the signer, your functionality on your dashboard will just say view, and it'll need to be sent back for edits. So in that instance, I would reach out to your signer and have them send it back to you to edit. Thank you. Any other questions? Again, we've got time. Feel free to put them in the chat or come off mute. Okay, if there are no more questions, I think I just have one more slide, and then I can just do a quick little, why don't I do a quick little run through right now? And then we'll do the last slide. Just to show you what it looks like in the live environment. Let's see, I've got my report up here. Okay, so let me go back to my dashboard. Okay, so this is an example of my dashboard. I also have UBO for access, so you can ignore that. But you're going to click on your NHQR dashboard. I'm assigned to quite a few facilities here, so I'm going to go to one that I just entered in for a demo, which was Harmon Hospital Skilled Nursing Facility. My report auto-generated here. And just a heads up, this is a dev environment. I'm not really submitting any data for Harmon Hospital. If you're on the call, I'm not submitting data for you. So my report ends up here, and then here's my dashboard. I'm going to go and hit edit on this report. I have all of my numbers filled out just so I didn't have to type them all in with you watching me. Fill them all out. Okay, I'm going to go ahead and hit send. And I had intentionally made a validation error. So to show you that there is your error here at the top of the report, I'm going to go and find it. It's down at the bottom. Validation error, click on here, shows me that the total doesn't add up. Fix it. And then this hitting continue should clear that validation error. And it looks like it does. There's no more validations. I'm going to scroll through and then I can send my report. I am both an editor and a signer on this facility. So I sent it. I've got my success page. I'm going to go back in and sign it after I review it and make sure everything is correct. Review. Everything looks good. Go ahead and select my name. Yep, I do want to sign this and send it to the state. And voila, it has been successfully signed and finalized. All right, okay, quick demo now. My final slide here, just talking about next steps. Oh, I think I saw a question in the chat about sending out slides. Yes, I will be sending out a copy of the slides and a recording as well. So next steps, reports are due in this new portal right now. The old portal is disabled. We're going to be using this new one moving forward. So please register and get started as soon as possible. The Q2 2024 reports are open for hospitals and hospices to begin submitting their data. Your deadline is typically the 30 days, like I mentioned, after the end of the quarter, but for this first report, we have extended it to 60 days, just as we get people registered and trained. So please log in, get registered, and submit your quarter two data. And then for skilled nursing facilities and intermediate care facilities who submit monthly reports, June 2024 is due in the new portal right now. And your deadline is typically the 5 days after the end of the month, and it's extended to 30 days for this first month. So yeah, those are your next steps. Get registered, get activated, and start filling out your reports in the new portal. Okay, final opportunity. Well, I wouldn't say final opportunity for questions. You can always email us with questions. Final opportunity for questions during this session. Anybody else? No problem at all. If you start registering and filling these out and questions come up, please email us at nhdr@comagin.org, and we can help you out there. All right, there's no more questions. We'll let you all go. I'll be sending you the slides and recording. And good luck getting all registered and filling these out. Thanks, everyone. Have a good day.